Good morning.
Good morning.
Good morning, everyone. Thanks for jumping in so ahead of time. You're ahead of the rest of the gang. We will get started here in a couple minutes, so just hang tight. All right. Good morning, everyone. It is 9. I just want to do a sound check here. Can anybody hear me?
We can hear you.
I can hear you loud and clear. Can you guys hear
Perfect.
me?
That's fine. Yes, sure can, Pete.
Yep,
Cool.
we can hear
Excellent.
you.
I can hear you too. I see all the thumbs up.
Great. Well, then it is 9:01, and I can, Pete, if your microphone's up and ready, then I can hand the microphone over to you.
Thank you very much. Yeah, I know we within our organization we have the thing of giving people 5 minutes to come in and 5 minutes to leave early, but we've had this tradition of the MOTS webinar going on for this many years, and 9:01, 9:02 we usually start. So why don't we just get going? And for those of everyone who comes in a little late, they'll probably know the spiel that we always start with. So good morning. Welcome, everyone. Happy 3rd of July already in 2024. It's life's going fast, isn't it? This event will be recorded, and we always do, and it will be placed on our website where you can review it later. If you happen to have another meeting or some urgent thing that needs to be taken care of, we'll set it on our website and you can review it later. Or maybe you think it's in the information that we're sharing with you guys today will be pertinent to other individuals within your organization or in the people that you work with. So you can always kind of point them to the recording that we have on our site. So, okay, Kayla, let's go ahead and look at the agenda that we have for today because we have plenty of things to talk about. Okay, we have the team that I'll show you. You probably know everybody by now, but there's always people coming and going and new within our organization. And we always think it's nice to put a face with a name. So objectives of this webinar, the roads go live delayed, unfortunately. Justin will be talking about a little bit about the last name at birth, because for some people that's an unusual field, but we've had it in MOTS for a long time and well, we're kind of sticking with it, and Justin will tell you all about it. Jody, our EDI specialist, will be talking about frequently asked questions because there's still a lot of things going on. And how to keep up to date is also one of Jody's specialties. So, and then Kayla will be talking about the changes to Citrix, the connection to the tools, to our apps. The MFA is a subject that Kelly will be talking about, and then specifically the MFA in roads, multi-factor authentication. Mary will be talking about the intro to MOTS. It's another webinar that we do on a monthly basis. And then Jody will be doing our standard spiel from CE to EDI or from one EDI to another EDI. They're fairly similar. So we'll be talking about that as well. And then we always leave some room at the end of the webinar for some Q&A. And if you have them, just save them to then. But we try to make it as interactive as we can. And if you have something that you would like to jump in, just raise your hand, and some individuals will be talking and telling you sharing your information. But within the team, there's usually somebody keeping an eye on what's happening within the team's tool. So if somebody has a question or would like to speak up, please let us know. So, okay, let's go with the MOTS team. There we are, Kayla Camilli, our MOTS system administrator and roads product owner. So that's kind of like the similar thing, but in a different terminology. We all know how that works. If we get new systems, we have to throw in some new terminology because basically it's also the system administrator, but we call it now a product owner. So it's a new term and it works. So Cecilia, our support specialist for MOTS, and she will be for roads in the future, I'm pretty sure, unless she decides to desert us, of course, but I'm pretty sure she'll be with us for quite a while. So my name, Piet Vermeer, MOTS Senior Systems Analyst, and also ODE, or the Oregon Health Authority Data Environment, formerly known as the Behavioral Health Data Warehouse product owner. I also have a product owner behind my name, so that should also be on there for those of you interested. Mary Hurley, similar as Cecilia, MOTS support specialist, and of course Jody, the EDI technical expert, and the roads product owner. She's sharing the title with Kayla because as one good proper organization should have, always your backups here and there in case people go on vacation, have things that they won't be able to make it to work. So it's always good to have a backup somewhere. And next in line is Justin. He's our MOTS report specialist and research analyst. So anything data that you can think of, go to Justin, and I'm pretty sure he might be able to help you. And if he can't help you, he'll find somebody else who will help him get the information we're looking for. So Anna Melcher, still newer on the team, but similar function as Justin, MOTS support specialist and data analyst. And you might have to Google the difference between a data analyst and a research analyst because to me they're pretty similar. But as I mentioned earlier, there's always some nice new terminology. And then of course Kelly, who is our communications analyst specialist for roads and MOTS and for other things within our Compass team. So in a nutshell, that's our team. And next slide, please, Kayla. The objectives. Why do we do this? As I started out, we like to give you any information of any changes, enhancements, improvements, things that might happen in the future about currently the MOTS system and of course the road system, because it's still called it's the MOTS/roads webinar. So we're going to be talking about both. MOTS is of course frozen. Everybody knows that, but there's still things happening. And there could be legislative involvement that might have an effect on our system. So if any of that happens, we'd like to use this monthly webinar every first Wednesday of the month at 9 a.m. to give you any information about anything happening. So we like to talk about data issues, and that's, for example, the last name at birth that Justin will be talking about. Feedback is always welcome, and we love to get it from you. And we have this platform, and whenever you have anything, please let us know. Or you would like to see some specific topic discussed in a more further detail, then we can put that on the agenda for the next webinar. And hopefully we can answer any of the questions that you might have during our webinar. Okay, that was everything I was going to use to introduce everything. So let's go with the roads go live. Kayla, go ahead.
Thanks, Pete. Excuse me. Haven't done a lot of talking this morning yet. This update isn't so new now. I think folks are aware that there's been some delays on our side, and we are still projected for a launch in Q4 of this year. So that is still staying the same. Otherwise, the main updates right now in roads is that we're pretty focused on finalizing our EDI documentation, and then also focused on getting the reporting aspect of roads working correctly. So that's where Jody and I are spending a lot of our time lately, is working with our contractor to shore those things up and make sure they're working in a way that's going to benefit providers. So still looking at Q4. If you have any questions, just let us know.
Sounds good. Thank you, Kayla. Next one, Justin, last name at birth field.
Yep. Good morning, everyone. Here I am again, your data analyst, talking about that last name at birth field. We emphasize this because the last name at birth is an important identifier in MOTS. It's used by the system to match individuals across the entire database. So if there's a variation in the last name at birth field, it might identify one real world person as 3 or 4 different real world people. And then since that's wrong, our numbers are wrong, our reports are wrong, and we have a much larger margin of error. So this is my reminder to please put names in the last name at birth field. I've seen an increase recently in variations of misspellings of unknown because the correct spelling is blocked. Lots of different types of NA entries, sometimes with a hyphen, sometimes without. And that one's problematic because Na is actually a real last name that we've encountered. And then some unusual stuff like single hyphens or declines to disclose or refuse to answer. And just to emphasize the problematic nature of this, it is a name according to the database, and MOTS can't really read and interpret other stuff that you might put in there. So if I was a client and you entered my first name as Justin and my last name as King and my last name at birth as unable to provide, then state records would show that I am currently Justin King. But when I was born, my name was Justin unable to provide. Obviously, that's incorrect. So again, just to remind everybody of the rule or the guideline that we've given for MOTS data entry, regardless of what your client may put on their intake forms, if the last name at birth is not known or has never changed, please put the current last name in the last name at birth field. And then if there are any errors, regardless of what they might be, if you've put in unable to provide, you want us to fix that, let us know. Just send an email to MOTS support and we can get those corrected for you.
Excellent. Thank you, Justin. Who's next, Kayla? It is Jody with frequently asked questions about EDI. There were some common issues. Go ahead, Jody.
Yeah, so welcome everybody. Thank you for being here. Super great to see all your bubbles and names. So this we wanted to put in here because we are getting some feedback, which we definitely want. So please continue to send feedback about the roads project, what you may or may not be getting information on, what you're possibly needing clarity on, if there's confusion around certain things. And what we wanted to just kind of provide some information to you on what has been happening with the roads system around EDI and your EHRs, and just kind of give you a little, not sure what the right word is. It's not a look behind the curtain, but we just want to make it clear kind of what we've been doing and what we're trying to do, even though the project does keep running into a few things that need more, work on them. So first off, clarifying the batch report status. And what that really means is I just want to clarify the files that are being submitted to MOTS and what will be expected to be submitted to roads. So currently you're submitting files to MOTS, and even if you're going with a new EHR, which I'm going to cover later, we want you to continue doing that. The road system is being designed to take in the MOTS legacy fields. We're calling them legacy V1. So when we go live, as Kayla mentioned, in Q4, your organization is not expected to have the new roads version 2 up and running and ready to go. We will be accepting the MOTS legacy files just as they come in today to MOTS. You're going to send them to your SFTP. That is staying the same. And when we do the cutover from one to the other, your files, you're going to keep doing what you're doing. The only difference will be there'll be a slight pause where they sit in your inbound folder a little bit longer before Roads comes online as like, hey, here I am to pick up your files and start doing something with them. So don't be worried that when you hear the word go live, that means that your EHR and you have to have the new version up and running and ready to go. Now, we have been working closely with your EHR providers. We have had individual connects with Ochin multiple times, with Credible, with Dr. Cloud, with CareLogic, with ReliaTrax, with some of the IT support internal to organizations that support that. And we have been letting them know what we are thinking of and how the structure for the version 2 is going to be designed. With that being said, until your EHRs or your internal tech teams get our finalized documentation, like the one that's signed, sealed, and stamped and is ready to go, even though your EHRs know that roads is on the horizon and they know that it has to be done per all of your state reporting, we're finding that a lot of them can't scope. They can't, I don't know if price is in the word or not, but they can't really get a fence around what the body of work is definitely going to look like and a document to use until we publish those. Okay, so we are in communication. We're doing the best we can to be as transparent as possible with the EHRs to the extent that we have been explaining how version 2 is going to be set up and structured. So basically, for those of you that are kind of want to know, I know this is getting a little lengthy here, but that's okay. So Roads V2 is built upon version 1. Okay, so the file itself, the structure, the segments, the fields, the values, those will be remaining the same. The differences we will see with V2 is we have added additional data segments of data that is to add to the collectability of it, such as, for example, Real D and SOGI, stabilization services, mobile crisis. So these are new segments of data that are going to be sent for your clients. And, those are new. But anything that is a field from version 1 that is not changing will still have even the same values. So a lot of the crosswalking and mapping and things like that, at least in the background, we've tried to be very mindful of what really needed to change and what didn't, in an effort to help streamline some of the processes to go to the next version. Now, you may see a UI, UX improve or change on the front end that you and your EHRs choose to do, but the back end piece of it, we tried to be mindful in keeping those in alignment. The documentation is going to be very clear to identify removed fields, fields that are staying but have a slight revision to them. Maybe they have more values, and then brand new ones. Okay, so this is why it's taken a little bit longer to get everything nailed down. But I just wanted to give you all just some insight into kind of what is happening, and that we are doing the collaboration. We did receive feedback from a number of you providers, which we greatly appreciate because it helps us to move that insight and information along to our leadership. And we're going to be utilizing the feedback we've received over the last couple weeks. We're going to be formulating an email to go out to folks, but we're also going to try to improve communication in newsletters, so that when you are getting a roads navigator or something like that, we can talk, or in MOTS Messenger, we'll talk a little bit more about the EDI docs and stuff like that. Even if there's no update, we're still going to put something in there to at least say it's still where it was at, so that you know that it's on our radar and what we're doing there. Also, we are looking to engage with the EHR user groups. So for those of you EHRs that may be with us today, if you have like a monthly user group, or you have some sort of cadence that you would like to plug us in for, like a 5-minute connect or whatever minute you want, just to let your folks know that's specific to you all, please send us an email. We're happy to get that on our calendars. We do know as your development starts, we'll probably be engaging with you even more once you get the documents. The goal is for us to engage with you and your teams so that we're available as you're moving along your development for questions, input. We're going to be riding alongside of you as much as you need. So if you don't have if your EHR doesn't have a user group, and you all would like to talk about having one, just maybe specific to MOTS or roads, let us know, and we're open to setting something like that up. We do have Credible as an EHR, and they and their partners, we have a monthly standing time slot where we connect, and they're nice. You have direct access to us here at the state, and your EHR's state reporting specialist, or whoever that identifiable person is. So there's a lot of options and things that we can do. We do recognize that, the project is taking longer, and there's sometimes a lot of, it causes a little tension and not knowing what's happening. But we're going to try to improve that. Please send us your feedback. Let us know what you think, good, bad, or otherwise. It's totally okay. And we're going to be doing these things because we know we've got a lot of work ahead of us, in the sense that once we get these documents out, there's just a whole nother body of work that's going to be starting with you all and your EHRs. And the other thing I was going to just finish up with, because I've been talking for like 5 minutes looking at the little counter, is that once the documents are published, we've been telling the EHRs that we understand it could take 3, 6, or up to 12 months for developing this and getting it ready to be certified by each provider for the road system. So the clock will probably start when those documents get finally published and they're solid. We are, though, understanding that y'all are going to take those in. You're going to take a look at it, and maybe it's going to take longer. I mean, we hope not, right? But we do realize that there's time frames. So we'll be getting with each of you EHRs and your partners and or your whatever you call them. Um, and we will be, just taking an honest, look at like, okay, what are your challenges? What are your barriers? Why would it need to be more? Or if you come to us and you're like, hey, it's only going to be 6 months, we're going to be like, super duper, that's great. so so we're going to be a lot more collaborating once we get those documents out the door. So I appreciate y'all being patient. Listen to me explain stuff. Hopefully it's been clear enough to at least provide some value and insight into what we've been trying to do. If you feel like your EHR or you haven't had an opportunity to connect with us individually, please reach out and we will carve out some time, Kayla and I and the team will, to make sure that we can get you folded in and looped into the project. So thank you all. I'm going to turn it back to Pete unless we have any hands up or questions. That's that.
Thank you, Jody. No, I'm
Sure.
not seeing any hands up or anything in the chat yet. So either you explained it clearly for everybody or everybody is still trying to grapple with everything you told them. So, but
Yeah.
we'll figure it out
Yeah.
as we go along. So
yeah, I just think the biggest thing is that if you haven't heard something from your EHR and like if you think maybe they just are completely unaware, that may or may not be the case. So just check with us, check with them. We'll all get our dots connected and we'll get some information for you. There's a lot
excellent.
going on in the background.
Yep. Thank you, Jody. Okay, Kayla, who's next? It is Jody. Keep your data up to date. Oh,
Oh,
take a
yeah.
quick sip, Jody, and go ahead.
I got me some tea with some caffeine going on. Maybe it's already kicking
Excellent.
in. So we're really encouraging folks to try to keep your data up to date. The more current it is, if you've gotten behind in reporting or you've got a few things out of alignment, maybe you have clients on your active client monitoring report that are in red and they haven't been updated in a long time. We want to kind of, take some time to maybe get with you and figure out a way that we can kind of clean some of this up. What we've found is, there's a lot of staff changes, different things, and that may have, led to things, either not getting closed like it should have or whatnot. So we want to be a little proactive since we've got a little more time, right, before we go live to make sure we get stuff as cleaned up as we can. There have been no changes to the reporting cadences. So if you're going to a new EHR or you're unsure, like, is the pause still in from COVID? Well, no, it's not anymore. And so if you are going to a new EHR, you're still going to want to go with the setup for MOTS, as I mentioned, Legacy. V1 is what we're going to be calling those, and they're coming into roads. And if it takes up to 12 months for even the new EHR you move to, you still want to get set up and going because it's going to be very similar. Just continue to report to MOTS, especially for you EDI providers. The switchover is going to be, I'm hoping it's going to be easier just because you're still going to use your SFTP and Rose is just going to pick it up. Okay. So also the portal access. Some of you may or may not log in and use the MOTS web portal because it does have some limitations on functionality that is, productive and meaningful for you all. But you should at least have one person at your organization and preferably a backup, so like 2, that have access to the MOTS web portal. If you've had access, but you haven't logged in for a long time, you're going to want to get with us and MOTS support so that we can get your access. And we call these P numbers. They stand for partner numbers because you're our partners and you get numbers so you can log into the system. And if you haven't done that for a while and you have one, it's probably become disabled. And we need to make sure that we can get that active. And the more we can start doing this, and then keeping you fresh and logging into the MOTS system on a certain frequency. It's the portal actually. Then that's going to make the transition to roads even better, because I think you're all going to be excited that roads portal actually has some productive tools and some meaningful things. So like you're going to have some dashboards that you're going to be able to see things at a holistic kind of widgets and different graphs and things. You're also going to actually have some interaction with your files if you choose to look at different files, the actual submission for the client. Did it go through? Did it not? You also are going to have a read-only portion on the side where you can actually search for your client in the road system, and it'll bring your client up, and it'll be like, oh wow, our client has 5 episodes of care that have been reported over time. Here's the most current one. Like, you're gonna be able to see what MOTS is accepted or roads in the system, and we are bringing over historical data. Okay, so there will be a lot of things in there you're going to be able to see on your clients that you had done even in the MOTS system. So if you keep your data up to date in MOTS, that's going to be good, because that's going to come over and show in roads. We want to clean up some stuff, so we want to help you close things. We want to help you assess. Maybe we'll just do a little assessment of where you're at and what you might need help with. And we're just really encourage you to keep reporting as you should, and let's get your portal access up to date. And if you don't have portal access, MOTS support and our team will help you fill out the right forms online, and they will get you some access. So yeah, that's I'm pretty excited about it, because the roads portals is going to have a lot more things at your fingertips to see and interact with your data.
Excellent. Thank you, Jody.
Mhm.
Yeah, it was always a bit of especially EDI, a bit of a black box. You kind of dump your file and then you got a file out. So this is a lot more transparent. So cool. Excellent. Thank you, Jody. And then who's next? Kayla, changes to Citrix. Go ahead, Kayla.
Thanks, Pete. So if you've seen some of our communications over the past month, we've been saying that our Citrix one-click will be going away July 1st. That was the information that we got from our technical team here at the state. So we wanted to make sure that we were getting that information to providers as soon as possible, trying to prepare people for a big change. We found out on Monday that that change is not happening yet. So Kelly and I were working really hard on Monday to put together instructions for what will replace Citrix one-click, but we do not need those yet. So for right now, keep doing what you're doing. If you need to reset a password, or if you need to set a password, Citrix one-click is still the place to go. And we will do our best, and as soon as we get information that is changed, we will pass that along to providers. So I think this is overall a fine update, because things aren't changing yet. And we will definitely make sure that people are given all the information they need when that change does come, so that people or folks know what steps to follow to accomplish the things that we need in Citrix right now.
And can I just add one thing, Kayla?
Yeah, hold on, Jody, 1 second. I see Sherry's comment. I can ask about that. That is not our website that we maintain, but I can definitely ask about that verbiage, because I saw that there yesterday too, and I was like, oh gosh, that's just more confusing for folks. So I'll ask our OSU about that.
Can you
go ahead,
elaborate on the question that Sherry had? Because not everybody picked up on that.
Sure.
Maybe.
Sherry posted a screenshot of our Citrix one-click page. And on the page, there's some asterisks at the bottom of the login section that say this site will no longer be available after July 1st, which is confusing now that it is still available after July 1st. So I will definitely ask them about that.
Cool. Thanks.
Yeah.
Sorry,
ahead,
Jody,
Jody.
you had something?
Yeah, the only thing I was going to add is for those of you that are like, what in the world is Citrix one-click? if when you get your P number to access the MOTS web portal, this is an aspect of getting logged in, and then also some of surrounding your password maintenance. So if you weren't sure what it was, it's helping you get your access to the MOTS web portal.
Right. It's different from the SFTP password.
Yeah. Just want to make sure that, in case folks were wondering, like, what is that?
Cool. Excellent. Thank you. Next one, MFA, multi-factor authentication inroads. Kelly, go ahead.
Yes, hi, good morning. So, regardless of what's happening with Citrix right now, multi-factor authentication is coming, and you will need that for roads. And I'm sure you have all encountered MFA when you've tried to log into your bank or doctor's office and that sort of thing. So it's just that extra layer of security to keep sensitive information safe. So all providers will need to configure MFA to use roads when it does go live. And we will be asking providers to either download an app onto your cell phone, and there is no transfer of data or sensitive material that will happen on your phone. It's just to verify that you are you. And then you would get the Microsoft Authenticator app. And I can pop a link to instructions for that in the chat here in a second. The other option is to use a YubiKey, which is a physical hardware token, and it plugs in to your computer in a USB port. And then you would also need to download Yubico software onto that computer. So it's a little bit more of a cumbersome process, the YubiKey. So we do recommend the using your phone. And our tech team is recommending a Series 5 YubiKey, and those can be purchased online or in stores. So I know that that might not be ideal for everyone to go purchase a key. So that is why we are suggesting that the using your phone and the Microsoft Authenticator is the no cost option. And so that is our recommendation. If you have questions about this or concerns, please reach out. We're here. Again, I'm going to pop that link in the chat for the instructions to download it, the Authenticator app. Just put that in there. And also Jody mentioned earlier the Roads Navigator. So if you're not already receiving that, reach out and let us know, and we'll add you to the mailing list, because that also has all the updated info about Citrix and MFA and training sessions and all of the support materials. So let us know and we'll get you connected with that. So thanks, Pete.
Thank you, Kelly. Yeah, and another thing constrained about the YubiKey is that it is it is set up on a computer and it is confined to that computer. If you happen to be working in a different location, different office, you cannot log in because it's set on and installed on that particular computer where that YubiKey is in there. So it's not transferable. And if you have an app on your phone, you can go to any of your different office computers, anything, locations, as long as you have that app. So that's a much easier and transferable solution to that problem.
Yes, so. Thank you.
Okay, the intro into MOTS. We're still introducing MOTS. Go ahead, Mary. Oh, that was the wrong one. There we
go. Good morning, everybody. So in addition to this monthly webinar that we have today, on the second Wednesday of the month, we have what we call an intro to MOTS, and it's for new people, new providers, and to guide to help you understand what is MOTS for, why do we collect the information, what do we do with the information, and how most important, we'll show you how we collect the information that is through the MOTS web portal for client entry. We'll demo an entry into the MOTS system, what it looks like, what kind of warnings you might get if the information is incomplete. Now, most of you here are EDI. You don't enter information through the client entry portal, but it helps you understand what goes on with the MOTS information that is that we ask for, and eventually roads. So roads is going to be very similar to MOTS in the information that we collect. So it's just very useful altogether overview of what MOTS is. And I think Kelly or Kayla will provide links in the chat for you to register for the next MOTS intro to MOTS. So
Yep, the link is in there. And then Patricia Garland also asked about the MOTS support email for a P number. And Patricia, I put a link to our user request form in there as well. And that's what you'll need to fill out to get a P number.
okay, thank you.
Thank you, Mary. Thank you, Kayla. Back to the agenda. And then we have Jody again, switching from CE to EDI. Go ahead, Jody.
Yeah, and we'll breeze through this, but this, as Pete mentioned earlier, this could be if you're CE and you're going to EDI. We have a few of them now that have notified us. But even if you're switching EHRs, or if you're updating your current version to another platform or something within your EHR suite, let us know. We want to make sure that we can get you on the horizon of everything that's happening. We want to get you plugged in and get somebody assigned to help you. If you're looking at a new electronic health records or new system, whatever, and you're really like, hey, I really need to have the MOTS functionality and all of this, actually find out what the process is for this functionality when you're checking these systems out. Maybe see how it works from client entrance to the submission to MOTS. You know, how much staff time will be required, who's going to do what. Again, there's no one way that's better than another, but there's just different workflows. Even when you're going from one EHR to another, you know, they have different ways of doing that. And it's really good to ask extra questions to kind of gauge what that's going to look like for your organization. And maybe you shift a few things around to have other people do other pieces of it, right? That's what we've been finding in our most current project that we're working on. So, it's just always nice to see how it works. Project timing, that is super important to us so we can get you into our schedule, have somebody assigned. There's a process for switching your data submission if you are going from CE to EDI. If you're EDI already, you're going to get your prior data submission method expired because you're going to need to recertify with the new one. So that gets to be a little bit tricky, but we make sure that we're able to keep everything moving for your current submissions and certifying for your new ones. If you are already EDI, your secure SFTP, file transfer protocol location, is going to stay the same. That is unique to your organization as a whole, regardless of what EHR you use. If you don't have one, we're going to help you get one. Get a location where your stuff's going to go. Client ID considerations, think about if your new system or your updated platform is going to auto assign or plug in other auto assigned numbers. We're going to want to make sure that our client IDs for your existing facility, if you're reusing that one, continuing to put data into that, which is completely fine, that we align those client IDs to match when the new system starts reporting. define your business processes. That's just kind of a thing for you all. But if you need some help or you have questions from us, we're happy to help you out there, provide what we can. Your files will be tested through EDI. So even if you go with an EHR that's currently submitting with other providers, your files will be tested individually, because with all the customization and all of the amazing things that these new systems are doing or adding features and functionality, we want to make sure that your setup in your area is all in alignment. So we go through that. It's pretty easy. We're going to go live, which means your files are certified, and then we're going to do some follow-up. And that follow-up is really just, we offer that so that as you're getting live files and you're actually in the process of submissions, we can answer questions on any like errors you might get back or different things, or like, hey, I just don't remember this. So we'll be there at whatever cadence that you all and us decide work best for you. So keep submitting to MOTS. If you're going to a new EHR, do the MOTS piece of it. If your EHR has any questions on whether or not they should, please get them in touch with us if need be, and we will get questions answered for them. So yeah, we're still rolling along doing things on the MOTS side. So yep, I'll turn it back to you, Pete.
Excellent. Thank you, Jody. That was short and sweet. Cool. Thank you. Okay. I think we're getting to the Q&A part, and there it is. I haven't seen anything pop up, but I see a hand raised by Thomas. Thomas, you have a question.
Yeah, sorry, for some reason I can't type in the chat. So I had question goes back to the MFA. Yeah, so if I have a provider who's using my EHR and they're updating for roads through the SFTP, do they still have to go through the MFA before they can submit?
So Thomas, if you have a new, let's say you get somebody brand new and you're getting them set up to submit through your processes, right?
Okay.
They're going to need, because we're going to need to get them set up with their agency and their facility. And we can do some of that for them, but ideally we want that provider to be able to log in. We're going to want them to go through training on roads and step through things. So they would need to get at least one person to be their system administrator or their roads person. They'll get their partner number. They'll go through MFA. And that's mainly just to work with us to set up their agency and then the appropriate facility and the data submission methods underneath it. Plus, it's going to allow them to get access to the additional features within the portal. Now, the SFTP and the way that Dr. Cloud sends files, automatically, right? And you re-ingest the results files. That piece is still going to happen, and that's not going to, they're not going to have MFA for that. It's just that we will want them to have MFA because we want them to get into the road system so they can kind of manage their setup and work with us to be able to do things. Does that make sense?
It does, Jody. Thank you for clarifying. So I can understand that implementation, they're having to go through all these steps. Well, my concern was if they were automating it, was someone going to have to do an MFA before the system would say, oh, okay, you're authenticated. You can now transmit this data to the road system. So thanks for the clarification. I do appreciate it.
Yeah. No, the SFTP is separate from the MFA logins to the roads portal. So it's kind of like a separate system of service that is just kind of it's different highway that stuff's coming in. So no, it's not necessary for that, but it is for them to get into the roads portal.
And we need to have a name, number, face, something to contact in case something happens on the others, on any part of the system. So
yeah, that's why we really recommend that primary.
And that's why we always keep asking to keep your information up to date. And if somebody leaves, if somebody new or some responsibilities change within the organization, that you keep that information up to date. So when anything occurs, that we can always reach out and say, hey, this is happening. What's going on? Who do we talk to? Where do we go? And luckily we have a good working relationship with a lot of representatives of the EHR, so that goes multiple ways. But to make it official, we do need to have at least one number, name, something to communicate with. So that's why we do all this. Thank you. Good question. Any other questions popping up?
Thank you.
You're welcome. Not seeing anything. Okay. As I mentioned at the beginning, a recording will be there under our MOTS website, webinars and newsletters, because we also do a monthly messenger or a newsletter, and we have one for roads as well, and it has a different name. It's not the messenger, but it's the roads, and I'm blanking on that one.
Navigator.
Navigator. There we go. So we have a compass and we have a navigator, and we're doing good. Okay, the next CE webinar. This was EDI focused today, and as you all know, and that's why Jody was talking so much. Next one will be focused a little bit more on the client entry, the CE part of MOTS. So signups are available on your website, and if there's nothing that anybody from the team has, any comments, hints, tips, there we are. All our contact information, MOD support and roads at odhsoha.oregon.gov. And we're all now oha.oregon.gov. Kayla, Cecilia, myself, Mary, Jody, Justin, Anna, and Kelly. Okay, that's all I had. Thank you all for joining, and have a wonderful rest of your day, and hopefully a great celebration of the 4th, and try to stay cool over the next couple of days, because it's going to be a nice scorcher, I've heard. So thank you.
Thanks, everyone.
Thanks, everyone. Bye-bye.